Jane Johnson, obviously co-CEO of AFA, and I'll be going through the slides today, introduction to professional registration, and Bertha, who's on the Professional Development Committee as well. She's there to help with all the questions, because when I'm showing the slides, I can't see what's being asked question-wise. So Bertha will be monitoring the chat, and then at the end, there'll be time for some questions and answers. The session is being recorded and will be saved on the AFA Hub afterwards, so you can go back and re-watch it. And all the historic sessions are actually on there as well, so you can go back and re-watch any of them. Just stay muted throughout, which you all are, which is great. So I shall just kick off now, I think, and get going with this, and then if others jump in on the call as we go, that's fine. So let me share my screen and then go on to slideshow. Right, hopefully you can all see my slides now. I can't see you, I can't see anything actually now apart from my slides. So professional registration, first of all, a quick guide to the governance of this. So the Federation of Informatics Professionals is our governing body. They are the ones that hold the public register. They're not a membership body, they're the umbrella organisation, and underneath that organisation they have a number of members. So there's AFA, BCS, CHIME, SOCTIM, IRIM, CILIP. There's a number of membership organisations who all offer professional registration that is pertinent to their field. So obviously BCS is quite, IT, data analytics orientated, but it's generic, whereas the AFA registration is much more focused on health and care data and analytics. So FedIP is our umbrella organisation, and you can't really see it's a bit small, but the public register shows once you have been registered, you go on this register, it shows your name, it shows the organisation you're registered under, which would be AFA in your instance, and what level you are registered at, date of registration, etc. There's a £25 annual registration fee payable to FedIP to be on the public register, and being registered, you have to be with that membership body as well. So you have to maintain your membership with your membership body, AFA, and you have to maintain your registration with FedIP. So if your AFA's £47 a year and your FedIP's £25 a year, then that's not going to embarrass myself by trying to add that up, but around about £70, and that keeps you registered for up to 3 years. Once you do your registration, it lasts for 3 years. So AFA, you know about. We are a member organisation for the analytical community, and we are licensed by FedIP to offer this registration route for analysts, and it's overseen by the Professional Development Committee, which Bertha and I are part of, and we're the ones that do the assessments, and we have to do audits, etc. throughout every year. We have to do random audits. So National Competency Framework, how that ties in with professional registration. Think of the competency framework at the skills that you need for a role. It's almost like a job description, the competency framework. And many people use the National Competency Framework to write their job descriptions, actually. And then in that's saying these are the skills we want for this Band 6 role, this Band 8A role, or whatever in data engineering, data analytics. And that's the tools that are needed for that piece of work. Professional registration is evidencing your competencies. So where a job description might be written using the National Competency Framework to show the elements that are needed, in the desirable section of the job description it might have professional registration, because that's the thing that shows that you are able to apply the skills in practice, and you can use those tools as mentioned through the competency framework. So why do we go for professional registration? It's all about demonstrating your skills and your competencies and showing your commitment to progressing your career. It's an independent validation, peer review of your knowledge, skills and ability. And with the registration, it's regardless of your job title, your job grade, what band you're on, your academic history. It is purely about demonstrating your competencies to carry out a task. We don't care what band you're at. We don't care what your job title is. We don't care what your academic history is. What we do care is that you can evidence your skills in carrying out a task. So to do professional registration, you have to think of, first of all, what level you're going to register and apply for. There's various levels. Associate practitioner is almost a promise that you will apply for one of the registered levels in the future. The associate practitioner level only requires a few hundred words of what you're doing, what your job is. It's usually for people that have maybe just come into health and care or just come into data and analytics and don't yet have the required skills to evidence that they haven't yet been able to evidence all their skills in the certain areas, but they're building up to it. It's a promise that you will register at some point in the future. And as long as you continue with your AFA membership and your FedIP registration fees, you will remain on the register as an associate practitioner. When you move up to doing the levels of practitioner, senior, advanced or leading, then that obviously is dependent on where your skills lie. When you apply for this, please use the official AFA registration forms only and use the most up-to-date ones because they do change. There's regular meetings with FedIP. We have to keep regular checks and standards being tweaked. And in fact, the whole layout is totally different to what it was a couple of years ago, and it's a lot more simple now. So if you started this way back, you might find you do yourself a disservice if you try and use an old form, because you might end up having to do more than you have to. So all the documents are there on the AFA website. This is what it will look like when you go in. You click for further guidance. There's FAQs and there's examples of reflective practice, because we use a reflective practice template for submitting your application, and you can get the application forms by clicking to apply. Now, when you go to apply, it will ask you to register up to the FedIP hub, and that's fine. Don't think, oh my God, I've clicked the button, I now have to start applying. You don't. Once you've clicked on that to get your application forms downloaded, then you have all the time in the world to carry on with your application. You don't have to do it this round or the next. It's just over time, as you've just registered yourself and you've registered your intention. And this is what you'll be filling out, really, the FedIP registration with the level you want to apply at. To carry on with the registration, think of 3 reflective practice pieces. Look at the templates, the available templates on there, to see the examples so you can get an idea of what the reflective practice is about, and start thinking about your evidence. In fact, save yourself a folder somewhere on your computer and start pulling together bits and pieces and keeping them in folders so you're ready to go. So the standards are, you require two to three, well, sorry, you need 3 reflective practice pieces, but if you've done this before and you're re-accrediting, you only require 2, and the re-accreditation process is not as onerous as the initial process. So there's a number of standards. applying methods, using methods to solve problems, organisation planning, autonomous practice, accountability, responsibility, communication, collaborative working, demonstrating professionalism, and continued professional development. Think of this as a journey. It is freehand wiggly line, and if anybody can do a better freehand wiggly line, I'm happy to let you try. So you apply your methods first of all, then you look at how you're going to solve the problems. What methods are you going to use? How you organize and plan once you've decided on the method to apply, how you're going to organize and plan this. There'll be a certain amount of autonomous practice. That will vary, obviously. So the standards are all the same. This is saying P1, P2. These are practitioner standards, but actually if it has SP or AP, it could be senior practitioner, advanced practitioner, or LP for leading practitioner. The headings do not change. The requirements underneath those headings are what make the difference between the standards. So autonomous practice is obviously going to vary very much between if you're going in as a practitioner or a leading practitioner, as with accountability and responsibility. Then as you go through your piece of work, you look at collaborative working, communication, and how this is all helped towards continued professional development. So here again, you can see I've got SP1. So we're looking at a senior practitioner leading standard here, applying methods, undertaking health and care data and analytics tasks relevant to your specialism, identifying, selecting and employing appropriate methods. And then we give some guidance there. Describe a situation which you've undertaken health and care data and or analytic tasks within your specialism under your own direction. What did you do? How did you choose your methods? What happened as a result? So start thinking about all these things. And you might have one big meaty project that you can use as one for your reflective practices, and then a couple of smaller projects for your other two. And then likewise, we go through what methods did you use to solve the problem? What were the problems required? What problems required them and why? How did you apply them? What were the results? Organization and planning. So again, how did you identify resources available? Autonomous practice. Did you supervise what codes of practice did you use? So that will all vary according to whatever the standard level is. Accountability and responsibility, accepting responsibility for the work of self and others where appropriate. That's at that particular level. But these competencies and the guidance will vary depending on which standard you go for. Communication's all about how you communicate. Is it oral communication, written, electronic? Did you go to meetings? Have you got emails, etc.? And you have to think about all these things, because when we start asking for evidence of your communication, if you say, oh yes, we had an email trail that discussed what methods we were going to use and what the output was going to be, then that email trail could be really good evidence for communication. So really think about, start thinking as you work through your collaborative working, for example, working effectively with colleagues. Do you have minutes of a meeting where you are named in those minutes as discussing one area? Do you have a meeting invite that you are involved in with a larger group that's working around this project? All those things, minutes, meeting invites, can all be used as evidence for communication and collaborative working. Code of conduct, this is one that often people stick with. We talk about applying, this is complying with the AFA Code of Conduct, demonstrating professionalism. It's really about the ethics and how you conduct yourself day to day. And we do have a link in there for the Code of Conduct. You'll find it on the AFA website. Use that and have a look at it. There's things in there, for example, diversity inclusion. If you have to do your annual EDI electronic, your workforce things that you have to do, like your IG compliance and your security and equality diversity, you usually get a little electronic certificate. That is evidence that you comply with the Alpha Code of Conduct, because you've shown through doing that that you can apply equality diversity. There's also something in the Code of Conduct about maintaining your professionalism and maintaining your standards. So you might have an electronic certificate because you went to an SPC course, or you might have an Eventbrite meeting invite to say that you went on an NHSR course or something like that. Those are all evidence of you maintaining and keeping up your professional standards. So they can be used as well. And they can also be used for continued professional development. We require evidence for each standard, but you might have a piece of evidence that covers two standards. So, for example, an electronic certificate saying you've been on a training course for Power BI, for SPC, for Tableau. That can be used in the Code of Conduct, because under that it says you will maintain your professional skills and you will look to continually develop. But it also shows continued professional development. So one piece of evidence can be used for two standards, but every standard must have a piece of evidence against it. Then we have a section on contextual standards. Now, this is about the healthcare element. So this is what you would not get if you looked at, BCS or something like that. The contextual standards impact on healthcare, awareness of the sectors, terminology used, healthcare informatics, information governance, GDPR. So again, IG, GDPR, use your annual certificate that you have to do for your IG training, your mandatory IG training. That certificate covers your C5 and C6 contextual standards. Impact on healthcare, it's about understanding where your piece of work, so think about your golden thread of all the methods that you've been using. The contextual standards are that golden thread throughout the roadmap you've used to build up the piece of work in your reflective practice. So this piece of work you've been doing, how has it impacted on healthcare? Have you worked with MDT? What is your, multidisciplinary teams? What's your awareness of the other sectors you've maybe worked with? Have you worked with community or mental health? You might be in an acute. Have you had to work with primary care? So have you worked with anyone outside of your sectors? What is your awareness of the sector's impact on what you are doing? Terminology, making sure that you are letting people know when you do your visualizations, when you are providing your evidence. It might be that you show a PowerPoint presentation that you've done that's got an acronym dictionary in there, or a report, just to say that you are helping people to understand the terminology you are using and how it fits in. And likewise, healthcare informatics, what's your knowledge of the wider, if you are an analyst, how do you work with your warehouse developers? Do you work with some of the scientists, statisticians, whatever? So again, awareness of how you fit in and how other data and analytics professionals fit within your remit. So the level you choose, the matrix is available on the website. As I say, the standards are all the same heading. So for example, autonomy. A practitioner, we would say, exercises autonomy subject to overall guidance and direction. So, you've been given a piece of work by your line manager, and you have to report back to them every so often, but day to day you're getting on and doing it with a bit of feedback to your line manager. Or it might be that so the senior exercises autonomy within limited parameters. It might be that you actually help others as well. Advanced practitioner, much broader autonomy, and leading practitioner, obviously, you know, much wider ranges of work. There'll be certain things like senior practitioner asks about responsibility of work of others, whereas a practitioner, you might not have that. Then the different questions as we go through, using relevant methods of and procedures. There might be a little bit more complexity to the senior levels or the advanced. Now, leading practitioner, a lot of leading practitioners are strategic, and they won't be able to demonstrate some SQL code because they haven't written code for a long time, because they're very strategic and they're overseeing the work of others. So if you're, you know, it's not that we ask for the complexity of the code to go up as you go up the levels. That's not what it's about. It's about where your role falls within that overall process. So use this to have a look and decide. It's in the application form what level you want to go for. You have to be able to pass every standard at that level. So you might go through and think, well, actually, you know, I can hit 50% of these at a senior practitioner, and I'm applying as a practitioner. Unless you can apply senior practitioner to every standard, you have to go for the lowest common denominating standard. But if you're very, you know, if you're getting close, you might actually think, well, next time I will apply at a higher level. And we have actually had an instance where somebody applied, I believe, as a senior practitioner, and the assessors, when they went through, thought they were worth an advanced practitioner, and they were awarded a higher standard than they had applied for. Example piece of work for a senior practitioner. So you're an analyst supporting a medical specialties at a trust. The elderly care directorate wants to establish a frailty service, so you're asked to provide analytical support. So you do some research and learning around the frailty and how to measure it. So you're immediately thinking about applying your analytical methods. How am I deciding what to use? And this is where you can start thinking, as you're working through, start thinking about what evidence you're going to use as well. Looking to see what data is available, helping to improve identification of frailty by adding a flag to your information system. You've analysed the data and presented it in a visual way, and your analysis supported the creation of a frailty service. So that would be an outcome to, you know, for your reflective practice of what happened. The outputs, so this final visualization is not your evidence to everything. As I say, evidence has to be for each specific standard. It's not about, here's the final output, assume that I achieved all the standards underneath. No, you have to evidence each standard, but that final output may well be one of the pieces of evidence of how you apply methods and how you visualize, you know, and present the data. You might have done it in a PowerPoint presentation, in which case the PowerPoint presentation could be evidence of communication. So to write up as a reflective practice, we use the STAR approach, which is situations, tasks, actions, results. You're going to map to these core standards, and you're going to map to the contextual standards of healthcare as you write your reflective practice. So using the STAR technique, the first thing, situation. So what is your experience? Write it up as a reflective practice. So you were asked to join a newly established multidisciplinary frailty core team as a data analyst lead to support the establishment of a frailty service. So straight away, you have covered SP7, collaborative working. Now, your evidence for that could be the email asking you to join the team. It could be the meeting agenda where you are listed as the, you know, one of the people invited, or or minutes that show you as an attendee of that multidisciplinary meeting. And that also gives you evidence for awareness of sectors because you've been working with a multidisciplinary meeting. So that one set of agenda items or meeting minutes could be your evidence for two things straight off. So in order to help implement the team priorities and work streams as an organisation, you signed up to the Acute Frailty Network programme. So there could be something there about a little bit more understanding on awareness of sectors and impact on healthcare. You attended various workshops with colleagues and to gain knowledge and understanding of different measures and tools. So there you've got continued professional development. So it could be an Eventbrite invitation that you use as evidence of attending the workshops, or it could just be an email inviting you to it. Because not everything's on Eventbrite, especially if it's an internal workshop that you've been invited to just through email. Then it's showing that the situation, you're apparent there was many different approaches to measure the cohort. So after several meetings and workshops, we were able to identify frailty and how you would present the data using a series of charts. So we're talking about statistical process control, whether it's bar Pareto charts. And that's talking about applying methods and using methods to solve problems. So you could have your chart there, your SPC chart, your Pareto chart, whatever, could be evidence of what methods you've applied in that. So think about how you're going to evidence those. The tasks. If we go, and when you're doing your reflective practice, write this down. There's a matrix on the application form, which you'll see, and you can tick it off as you go. Again, standard SP1. I've got this evidence. It's in reflective practice 1, 2, etc. So write your standards in the little brackets like this. It helps us as assessors to follow what you're doing. So you're looking at attended several measurement meetings with other analysts to discuss best practice methods. So again, meeting attendance notes could be used as evidence of using methods to solve problems. Here we've got a bit about autonomous practice. It became clear to identify and measure the pathways. You needed this scoring method, frailty score, and it would be attributed at the front door. So that's something that you establish. You need to be monitoring data completeness for that new method of scoring the frailty score, which you established. That is an evidence of autonomous practice. It might be a screenshot of the frailty score. It might be an email between you and the technical support, setting it up, confirming that that flag is now in there. So again, think of your evidence. Then you need to write, sorry, I've gone back one. Where am I? No, I've gone the wrong way. Task. SQL script. So again, applying methods. It could be just a screenshot of a SQL script. And then looking at your understandings, you improved your knowledge, enlisted help from clinical colleagues. And so you're looking at organisation and planning here and collaborative working. You planned out and organised these meetings to help you improve your knowledge, which was all through collaborative working. So again, the meeting invites. And then you developed a series of charts. So you can use that as communication. How did you communicate? That could be your visualizations. Actions. You did some workshops, so which evidences all these areas: applying methods, autonomous practice, accountability and responsibility. You took it upon yourself, so because you would be responsible for creating the metrics, and it's all CPD as well. Writing your scripts is applying the methods and CPD because you did some training with BI team. So all these, I'll speed it up a bit now. As you can see, you can go through, and through one reflective practice, most people can hit nearly 75% of the standards. And through this example alone, I think we've actually pretty much covered all of them. Maybe some of the contextual standards not quite all there, but a lot of them. So C3, terminology, presented the data, had regular meetings with the frailty core team, ensuring explained any terminology. So again, if you have data with words on there or a PowerPoint presentation, something along those lines. If you can't get a piece of evidence, we will accept from your line manager an email saying, I can confirm that, so-and-so did do this, that, and the other. If there's problems, we can have calls with you, but most of it should be easy enough for you to find. And then finally, the results. So it shows here, what were the results? Frailty team were happy. They were impressed with the work. As an organisation, we could track the frailty patient's pathway. We got more of the contextual standards here. Now your impact on healthcare. You can identify frailty well and have quantified the need for the service. That's a huge impact. Here we've got information governance and GDPR. The patient identifiable data was handled and processed with strict adherence to local IG standards, which you took responsibility for. You can't evidence that sentence, but what you can do is give us your annual mandatory IG training certificate. So that's where we go with that. And finally, this is what it looks like. It's on one sheet of paper. We don't ask loads and loads and loads. Just put all that reflective practice into one, and the template is in the application. And then we ask for what went well, what went less well, what did you learn, and what would you do differently? We want honesty here. It's about earning, it's about progressing, it's about developing yourself. So what went well? Once the score was available, it started going well. You were dealing with people who knew far more about frailty. You received great feedback. So all those things went well. What didn't go so well? There was a time when you were being asked to produce data on frailty, but it was impossible because that wasn't there. You were attending workshops, therefore, but they still couldn't identify the frailty scores. So you're reliant on many other factors. So that didn't go so well, but you learnt, you got that together and you got the scoring in there. What did you learn about incorporating different graphs? In particular, the Pareto, as you felt it sat well with the frailty. Your knowledge has increased. The impact on resources, long waits, A&E, and satisfying to see the data produced and presented contributed to change in the organisation. What would you do differently next time? Be less hard on myself and apologise less for things that are out of my control, because you do that. Oh, I'm sorry, I can't do that because we don't have that data. It's not your fault. Yes, obviously you want to apologise, but taking that approach. So they didn't have long to write the scripts and understand the data, tidying the data. So in hindsight, I probably should have asked for an extension because of the timescales. So that's, what would you do differently next time? Really think about that. Evidence. Here's some examples of evidence. Clicking on links to go to, I don't know if you'll be able to see that so well, about, registering for webinars and the responses you get from attending, measurement fact sheets, understanding, collecting frailty data. So this was something that was done obviously for the Frailty Network, about what was the plan that you did, the analysis that was done. So it's obviously a screenshot of the measurement fact sheet there. But, you know, we spoke about the different evidence as we went through. Here, you know, an output, a screenshot of some script, SQL script, screenshot of a pivot table from the results. This is an email that somebody's received thanking them for their time and the work, you know, that's been done. So it can be emails between people discussing the outputs, discussing it all comes down to communication, collaboration. Here they've written an email saying, following through the frailty meeting, attached a number of records where the scene for conclusion times after departure time, resulting in minus calculations. So this is you again paying attention to the you know, the data completeness, data quality, and how you can assist. It's your communication with people to make sure that you get the right responses, the right outputs for them. Meeting minutes, your name's in there showing that you know, took an action from a meeting. Evidence, a certificate, completed your IG digital, you know, learning program, any mandatory training. This one, struggling to read, you will be able to see these on the website. So it's really about what the request is, and then just you looking for additional information. It's all about understanding, working with people, communicating, understanding the implications for the wider healthcare. So the application form, we just asked for a little profile, very, very brief profile. If you've had any published papers, conference presentations, awards, not if you don't, that's fine. You know, this section will be blank. It's just if you do, put it in there. Formal qualifications, but as I say, this is just an overview for us. It's not something, this doesn't impact on the assessment. And then a bit of career history, and we're talking lines, you know, a couple of bullets. I don't want whole CVs for your whole career. You know, it might just be information manager, organization, key duties, you know, managing team of information analysts, ensuring statutory reporting, supporting director, you know, the different directorates requirements, or publishing board papers. It can be just a handful of bullets. The application form itself, which this is the matrix I said, when you're writing your reflective practice, tick off as you're going through. So you can see here, reflective practice 1 actually covered everything but C4 and C6. Reflective practice 2, think, what did I do where I could maybe cover that? And, you know, write your reflective practice around that. But your first reflective practice has ticked just about every box. As you're going through and you're thinking about, you know, what your evidence is, applying methods. I did SQL and I used SPC, and so, you know, save those as evidence, and then you can say, right, I did applying methods, I used SQL, so E4 might be your SQL, and I've talked about that. E2 might be SPC, but SPC can also be used, as I say, down here in continued professional development. So you might have an E2 in there and an E2 in there. Here, E3, one piece of evidence has covered 2 standards. So as long as every single one, and here we don't, autonomous practice is sometimes the problem. Let me go back to that. An email from your line manager saying that, you know, they handed over responsibility for you to get this piece of work done and you did it. That's fine. That's all we need. the application form, there's two areas. If you find that you can't fit something on your reflective practice, and you've got one standard that you haven't been able to cover, SP8 actually here, demonstrating professionalism, they haven't been able to cover that. So what they've done is they've written about it in the commentary, but you still need to evidence that. So if you can't fit it into a reflective practice and you're really struggling to get a standard in there, don't worry. You can do it as a separate bit of commentary. And then the C standards, we just ask for a brief commentary there, and all these examples are in there. Sponsor, so just who's sponsoring you. It can be, you know, line manager, a peer. If you have somebody who's also professionally registered as your sponsor, then they can check the evidence for you in advance. So that's kind of a given and approved before it even gets to the assessors. That's the evidence verification here. Then you go back into the hub and you upload all your evidence. It says here about, you know, you can progress how you're doing. When you've gone in, you will download the applications and then you can upload them all as well. So that all happens in the hub, but it is well, the instructions are pretty clear on how to do that. And then you can go in and upload your reflective practice statements. If you want to add any more commentary, you can, but again, you can leave this blank. It doesn't matter, and just save. Key dates for this time round. Obviously today we're having the intro workshop. 1st of January, the registration window opens. Then we'll have a Q&A workshop mid-January. The registration window closes 31st of January. So what we do mid-January is we hold another workshop for those people that have really started filling in the forms and may have some final questions. Well, I've done this, but I can't cover this standard, or I'm not sure how I'm going to evidence this. Bring it to that workshop and we will help you through it. We want to get you through this. And once you have submitted, if we find that you have missed something, we will email you, we will give you a call, you know, we'll arrange a Teams meeting with you, or we'll just say, oh, can you just send me the certificate? You mentioned something here. Can you send me something to evidence it? If it's not all there when we receive your assessment, we're not going to automatically fail you. What we'll do is go out of our way to get everything we need from you to get you through that. So don't think after you've submitted, oh, I forgot to attach something. If we think something's missing, we'll be in touch. It's not a fail. We're there to try and get you through. We get the applications assigned to us in February, and then in March, the Professional Development Committee sign off all the assessment recommendations. So now we're over to questions, and I'm going to stop sharing. So I've got no idea what's been going on in the chat because I didn't see anything. Oh, and yeah, so we've got some links there that Bertha shared for further information. Has anybody got any questions?
So while you are thinking for some of the questions, I will just like to highlight that the STAR approach is simple and it's structured because it's competency-based methods. And definitely, please, I would strongly suggest to use the matrix standards on the application form, because that helps you to track this and evidence as well.
Thank you.
Yes.
Celine, you've got a question. You're on mute.
Hi, Jen, apologies.
Okay.
My question is around a little bit the maybe definition of the analyst. My primary specialism is a business analyst with with secondary specialism around the data analyst role. So I completed data analyst apprenticeship, but still working as a business analyst with supporting and data analytic projects. So I can still register as a professional. Sorry, I missed the first 5 minutes, but can I still register as a maybe senior or advanced practitioner with just the view that I undertake these different roles?
Yes, as long as you can show a piece of work, a project you have done, and evidence that you've met those competencies, then your job title is kind of irrelevant. Your job grade, your job title, your academic qualifications. That's what we're looking for. Is the question asks you this: have you done this, and can you evidence it? And if it's all a yes, then yes, you can go ahead and apply. Don't worry, because some people are called performance analysts, but actually they do the whole information and data side. It depends on how your organizations are set up. In some places, information and performance are together. In some places, BI and performance is together. In some places, all of that is just called the information team. So we don't really put much on the titles because everybody's different.
Cool. Thank you very much.
So thank you, Andrew. I see you have to go now. Right. So any other questions? No? Well, all the evidence, as I say, this recording will be on the hub. Recordings of all the previous sessions will be on the hub. Examples of reflective practices are on the hub. Example applications are on the hub, and you can go back through, as I say, watch any of the recordings. So, and let's see. Oh, there's a feedback form. Yes, we're just asking people if possible. I think there's only about 5 questions on there. It's just tick a box, really. It's very, very quick, just so we can make sure that we tailor these sessions to be more useful. So if you could please do that feedback form for us, that would be great. It will take you a couple of minutes. Matthew, no questions. Excellent. That's what we like to hear. Okay. So, Francis, you also seem to be okay with it. Well, if you do end up submitting in January, for the 1st of January, because you can start now, you just can't submit anything until the 1st of January. Then come to the workshop on the 13th if you have any further questions, and then you can, hit the button a bit more confidently when you do that submission. I mean, you could submit on the 1st of January if you want. If it's all done and you're confident, you might have been talking to a colleague who's done it and says, that's great, that's fine. But if you've just got any little questions or niggles, then come back to the Q&A workshop, which is halfway through the submission month. If you don't go for January, the next submission month will be March. It's a quarterly process. Okay, right. Well, thank you, everyone. You've got 9 minutes back then to go and make yourself a cup of tea before your potential next meeting or lunch or whatever. Okay, thank you all for coming.
Thank you very much.
Right.
Thank you.
Bye.